Hi, everyone. I'm Dr. Reena Malik, a urologist and pelvic surgeon, but also an educator and someone who believes that understanding your body is the most powerful form of self-confidence you can ever have. Today, I want to talk about a topic that carries both curiosity and stigma: penis rings, also known as constriction rings or cock rings. And no, this isn't about taboo or fantasy. It's about science, awareness, and the emotional truth that men deserve to understand their own sexual health without shame. Let's start with what a penis ring actually does. The basic concept is surprisingly simple. It's a device usually made of silicone rubber or metal that fits around the base of the penis, sometimes also around the scrotum. Its purpose is to help maintain an erection by trapping blood inside the penis. Normally, when you become aroused, blood flows in through arteries and fills the erectile tissue while veins carry some of that blood back out. A penis ring gently compresses those veins, slowing the outflow and helping the penis stay firmer for longer. On a biological level, it's straightforward. On an emotional level, though, it's deeply personal, because for many men, losing the ability to get or maintain an erection isn't just about sex. It's about identity, intimacy, and fear. I've seen countless men come into my office who've tried everything from pills to supplements to devices, not because they're obsessed with performance, but because they're desperate to feel normal again, to feel connected, to feel enough. The first important truth here is that a penis ring is not magic. It's a tool. It can help with blood flow, but it cannot fix the underlying cause of erectile. Erections are complex. They depend on nerves, hormones, blood vessels, and emotions all working in sync. So if you're struggling with ED due to diabetes, low testosterone, nerve injury, or psychological factors like performance anxiety, the ring might help you maintain an erection, but it won't heal what's causing the problem in the first place. I remember one of my patients, let's call him Sam. He was in his early 50s, newly remarried after a divorce. He came in embarrassed, barely able to look me in the eye, and said, "Doc, I tried one of those rings, and for a while, it worked. But then when I stopped using it, everything went back to how it was before." What Sam needed wasn't just a mechanical solution. He needed to understand his body, his hormones, his stress, and even his sleep. Once we addressed those, he didn't need the ring anymore. What he found instead was something much more powerful: confidence rooted in awareness, not dependence. The second lesson I want to share is that tools like penis rings can be empowering when used safely and with understanding. There's a reason why medical-grade constriction rings exist and are often recommended as part of vacuum erection therapy. They can help men who have mild to moderate erectile dysfunction, especially those who can achieve partial erections but struggle to maintain them. When used correctly, a ring can help increase satisfaction for both partners and bring intimacy back into relationships where it's been missing for years. But safety is critical. The ring should never feel painful, tight, or uncomfortable. It should not be worn for more than 20 to 30 minutes at a time, and it should always be removed immediately if there's any numbness, discoloration, or pain. The penis is highly vascular, meaning it has delicate blood vessels, and if you restrict blood flow for too long, you can cause damage. I often tell my patients that these devices are like training wheels for sexual function, helpful for stability, but never meant to become permanent. Another story that comes to mind is of a man in his 60s who came to me after years of avoiding intimacy. He'd had prostate surgery and felt like that part of his life was over. He said, "I just don't want to disappoint my wife anymore." We tried medication, but what helped most was a combination of a vacuum erection device and a constriction ring. For him, that little ring wasn't just about erections, it was about reconnecting with his partner. It reminded him that his body still worked, that he was still capable of pleasure and closeness, and that emotional healing was more profound than any physical effect. The third lesson is about the deeper message behind the search for tools like this. We have to talk about men's sexual health without shame. We live in a culture that tells men they must always be ready, always perform, always satisfy, as if arousal and function were switches that can be flipped on command. When things don't go as expected, men often feel humiliated or alone. But erectile dysfunction is incredibly common. Nearly half of men over the age of 40 experience it in some form. Yet few talk about it openly. That silence creates pain. It builds walls between partners. It makes men chase quick fixes instead of real healing. So part of what I want you to take from this conversation is that there's no shame in needing help, whether that help comes from therapy, medication, or yes, even a device like a ring. It doesn't diminish your worth. It doesn't make you less of a man. It makes you someone who's brave enough to care about their health and their relationship. Let's talk about the fourth lesson. Communication. The most overlooked part of sexual wellness isn't anatomy or technique, it's honesty. If you're in a relationship and you're struggling with ED, your partner likely already senses it. The distance, the hesitation, the change in confidence, it's felt, even if it's not spoken. When you communicate openly about what's happening, you transform what could be a source of shame into an opportunity for connection. I once spoke to a couple who had gone nearly 2 years without sex because the husband was too embarrassed to talk about his erectile problems. When he finally opened up, his wife cried, not because of the issue, but because she'd felt shut out. They started exploring solutions together, including using a penis ring as part of therapy. It wasn't just a device anymore. It became a symbol of teamwork, patience, and rediscovered intimacy. And finally, the fifth lesson. The goal is not just stronger erections, but stronger relationships with yourself and your partner. When you focus solely on performance, you miss the deeper essence of intimacy. Connection, trust, laughter, and presence. Tools can support function, but it's love and understanding that sustain connection. A ring might help you stay hard longer, but it can't teach you to be vulnerable, kind, or open. Those are the true secrets to lasting satisfaction. In my years as a urologist, I've learned that the most powerful healing doesn't come from medication or devices. It comes from self-compassion. When men stop blaming themselves and start seeing their bodies as allies instead of enemies, they open the door to true recovery. That's when medical tools become what they're meant to be, helpers, not crutches. So is a penis ring the secret to stronger, longer-lasting erections? The answer is it can be part of the solution, but it's not the secret. The real secret is understanding your body, talking openly, addressing the root causes, and remembering that your value doesn't come from performance. It comes from connection. If you're struggling, please don't suffer in silence. See a urologist. Ask questions. There's nothing weak about wanting help. In fact, there's incredible strength in vulnerability. And if you choose to try a penis ring, do it safely with proper guidance and with the mindset that it's just one tool in a larger journey toward confidence and wellness. I want every man listening to know this. Your worth isn't measured in minutes or erections. It's measured in how you show up, in your honesty, your effort, your care. Intimacy is not a test. It's a language, and the more you understand your body, the more fluently you'll speak it. Thank you for being open to this conversation, for listening not just with curiosity, but with courage, the more we talk about men's health. Honestly, respectfully, and without shame, the more healing we bring into the world. Good luck on your journey toward better health, confidence, and understanding, sis. And remember, true strength isn't found in what lasts longer. It's found in what's real. Thank you.